Hello, everybody, and welcome to the 5th episode in our Apollo educational series. My name is Arash Tagvai, and I'm one of the medical graduates that works at Apollo. Today's presentation is going to be based around the topic of arthritis. Guys, this is a big one. A large percentage of the patients that come to Apollo and who are helped by Apollo are suffering from these conditions. There are two types of arthritis, but before I get into more specifics, I'm going to give you guys a brief overview of who Apollo is and medical cannabis and the endocannabinoid system. So pay attention and let's get through this together. This is going to be a good one. I'm very excited about it. I'm just going to share my screen with you guys so we can get started. And away we go. Okay, so as mentioned, my name is Arash Tagvai, and today's presentation is about arthritis, and we also are going to be sharing some of the pain research that we have had published recently. So we're very excited about this episode. So initially, who is Apollo? If you don't know by now, guys, Apollo is one of the largest medical cannabis clinics in Ontario, which makes us the largest in the country. Initially, Apollo was started by a small congregation of physicians that were running out of treatment options for patients that they were treating for chronic pain. So initially, again, it was just to pay attention to the information and the data they were collecting. What they found is that word travels and good news goes faster than any. So they decided that they were going to take on new additional patients for monitoring and the use of medical cannabis. We now fast forward to where we are. We have well over 50,000 patients rostered in our clinics, and we see patients across the country, coast to coast. We are deemed an essential service, and we have allowed our services to be available to all our existing patients and new patients from a virtual platform. We're very proud of that. So that's who Apollo is, and I'm diving right into medical cannabis, guys. Everyone will have by now heard of the term of CBD, okay? Stands for cannabidiol. This is one of the chemical compounds that we remove from the medical cannabis plant, and it has multiple effects in our body due to its connection to the endocannabinoid system. I will go over that system later in this slide. CBD is very now popular. Everyone knows about it. I have mentioned a few of the therapeutic effects that we have recorded in clinic. If you ask me what the bigger heavy hitters were on this list, I would say the analgesic, which is a fancy way of saying painkiller, and the anti-inflammatory to reduce inflammation. Okay, so these are the two big reasons we use CBD. It also has antipsychotic effects. It can help as an anti-anxiolytic. There are lots of positive things that can be found when it comes to the use of CBD. THC is the other compound that we take advantage of when in the world of medical cannabis. Now, sometimes people like to call CBD the medical component and THC the recreational component. We don't like those terminologies because we firmly understand that both play an important role when it comes to medical cannabis, guys. We have to keep that in mind. THC also has anti-inflammatory properties, but its main use in clinic after pain relief and an analgesic and an anti-inflammatory is its help with insomnia. Guys, the chronic pain cycle is something that we deal with all the time in clinic. People who are in chronic pain will eventually graduate into what is called chronic fatigue. And it's a very, very vicious cycle. If you're in pain, you can't sleep. If you can't sleep, well, then the next day you're in more pain. So again, THC is the very important compound that we use in clinic to ensure that patients are finding some rest again. Now, CBD and THC are components from the medical cannabis plant that we use in a prescription form in clinic. I added this slide in and I've gone over it before, so I'll be brief and I'll be quick. Trichomes. These are tiny little oily projections that come off of the plant, and this is literally where the CBD and the THC are found. That is where they live. These big companies that are growing medical cannabis for the use for patients approved by Health Canada are basically growing these little guys here. Trichomes are the most important portion of the plant to them. Now, there are other people that tell us they use this portion of the plant for other things and they use this portion of the plant to help them that way. And that's all great. We love to hear that. We love the feedback, and we're learning from patients from time to time as well. But as of now, Health Canada approved use of medical cannabis comes from the plant itself and these tiny little trichomes. I always thought this was interesting. Guys, this is the endocannabinoid system review starting here. So remember, our bodies have a system in place that creates endogenously from our own body, creates 2-AG and anandamide. These are two chemical compounds that play a role in this system. CBD and THC mimic those compounds, and we can tap into a system that is already in place, and we can benefit medically from using this system with that plant. So cannabinoids and endocannabinoids, the difference between them, endo is endogenous. These are the ones that we produce, the 2-AG and anandamide. There are synthetic cannabinoids out there, nabilone, sativex, those are some examples. And then we also have cannabinoids that come from plants that are known as phytocannabinoids. So we use phytocannabinoids to tap into the endocannabinoid system to attain benefit. A few of these things I've already discussed, but these are some of the recorded benefits that we have found in clinic from either the use of CBD or the use of THC, most commonly the use of both. We often combine them throughout the day and the evening, depending on the patient's requirements and to find optimization of treatment. So it's an excellent list for us to remember. At the top of this list is inflammation, pain, and I'd say number 3, digestion and sleep are almost combined here. They're very, very important symptoms or conditions that we treat. This is a further breakdown of what is exactly going on in the endocannabinoid system. Guys, this is feedback that we have received. People want to know exactly what's going on. Now, if you look at this slide, I will tell you now, this is every medical student's nightmare. This is the pre- and post-synaptic cleft of your neurological system. Pain comes in at your fingertip and it travels up and into the central nervous system, and that's when we know to move our hand away if something is burning us or causing us pain. Again, this is the exact snapshot of where cannabis acts. 2-AG and anandamide are the endogenous compounds that we produce in our system. And so with CB1 and CB2, this is where both CBD and THC play a role in our neurological system to help with pain and with multiple other conditions and systems, which I'm going to show you here next. I hate spending time on this slide, guys. I hope that's enough of a breakdown for you. It's important to take away that there is CB1 receptors and CB2 receptors in the pre- and post-synaptic cleft that make a difference for our pain reception. So once we understand that the endocannabis system can be used, the endocannabinoid system can be used to address pain, we can step into the topics of arthritis. Guys, 90% of the patients that we work with and to help in Apollo have similar conditions to the ones I'm going to address with you guys today. There's a lot of pictures on this slide, so I'm going to take my time to overview this quickly with you. Initially, this is a normal joint, okay? Osteoarthritis is the term for wear and tear of a joint through time, through use, okay? So osteoarthritis is wear and tear, right? It's very important to know that. Rheumatoid arthritis, now this is an entire different ball game. Rheumatoid arthritis has a very similar name to osteoarthritis, but remember, guys, rheumatoid arthritis is an autoimmune condition. What does that mean? That means that your immune system is attacking the joint. In medicine, when we don't know the cause of something, we use a fancy word. We call it idiopathic, which simply means we're not sure of the cause. Rheumatoid arthritis has a genetic predisposition, and we've studied it long, but we don't fully understand why it happens. There are modulations that we have taken and steps that we have taken to control disease progression. And again, I'm going to get into that as I go. Again, wear and tear versus autoimmune, okay? Both conditions are considered chronic pain. Both of them, it's very important to address the patient's sleep cycle as well, which is why I've put here, sleep cycle is very important. At the bottom of this slide here, I've put something that's very, very unique to rheumatoid arthritis. This is a finger, and a normal joint, it'll go fairly straight. But with rheumatoid arthritis, because of the scar tissue that builds up from the autoimmune attack in the joint, one of the main things that we will see is called a swan neck deformity. And the patient will present with bends in their joint, and they will literally look like a swan neck, right? So I just always remembered rheumatoid arthritis that way. The presentation of the conditions are also very different. let me just get to my notes so I'm ensuring that I'm not missing anything here. But one of the main differences between the two is the presentation of pain. Keeping in mind that osteoarthritis is wear and tear, degenerative disease, often patients will report, well, if I spend a little extra time playing soccer with my son, or if I was skating more this winter playing hockey with my friends, I can feel it in my knees, I can feel it in my hip, or I can feel it in my back. That's the classic presentation after use. Often osteoarthritis is worse at the end of the day. After a long day's work is when the pain is present. Rheumatoid arthritis is the opposite. Okay, I want to make this very clear. Rheumatoid patients wake up with pain. And the condition is also non-specific to any particular joint, but it often starts in the hands, a very, very high rate of starting in the hands. Patients with rheumatoid arthritis will report to their physicians that they wake up with pain in their hands. It is the first thing that they feel in the day. Often they say that they have to spend 30 to 40 minutes just warming up their hands and kind of stretching in bed to make sure their joints are good to go and start their day. Right? So this is an interesting difference between the two. It's very important to remember that. A further breakdown of rheumatoid arthritis, and remembering that it is an autoimmune condition, it is tested for objectively. There is a blood test that measures for what is called rheumatoid factor. A family doctor may test for rheumatoid factor with a blood test, and once confirmed, may ask for the extra opinion or the analysis of a rheumatologist. So they will refer their patients to a rheumatologist and say, hey, look, I have had this patient under my care for many years. Recently, this pain has started. I have objectively diagnosed them with rheumatoid. What other treatment options can you give me, as opposed to just the regular stuff that most patients will use for chronic pain? Now, because it is an autoimmune condition, the treatment modalities are to address the immune system. The class of medications used are called biologics, which is another way of saying immune suppressants. Sometimes, based on what the rheumatologist decides would be the best process for the patient, they're started on short courses of short courses of medications that'll slow down the immune system. Prednisone is one. It's a very, very harsh steroid. If necessary, a rheumatologist will keep a patient on prednisone, but generally they do very short courses because of the high side effect profile that comes with the use of corticosteroids or prednisone. Methotrexate is another medication that a rheumatologist may choose to use when it comes to the treatment of rheumatoid arthritis. Guys, methotrexate is a medication that is used in medical oncology. At high doses, it can stop cell cycle replication in cancer. In lower doses, it can be used to slow down the immune system to stop the attack of joints from rheumatoid arthritis, guys. So these are very, very serious medications. No physician likes to use them openly or generously. They use them in short courses and in short bursts, and they'll measure subjectively how the patient is doing and objectively what the rheumatoid factor is telling them in a lab. So if they can reduce the rheumatoid factor and not use methotrexate or prednisone or any other biologics, they would do so. Osteoarthritis is more wear and tear, like mentioned, right? This is something that 90% of all people will feel at one point in their lifetime. And the treatment is generally rest. You want to stay off of that joint. You have to remember you're not in your 20s anymore, and you can't keep running around at the same level that you used to. Also, there can be benefits to using pain management medications, and that is your typical NSAIDs or anything over the counter, your Advil or your Tylenol. When we address this condition in clinic, we want to make sure that patients understand medical cannabis can be used for both. If using medical cannabis for osteoarthritis as a painkiller, as an analgesic, a patient can use CBD throughout the day and a combination of THC and CBD in the evening to address sleep and further reduce pain at night. When these conditions are present is when a patient can use medical cannabis, when it comes to osteoarthritis. When it comes to rheumatoid arthritis, we want to ensure that patients understand we want to use the medication a little bit more regularly, guys. CBD must be used for at least 4 to 6 weeks for us to even understand if there is a benefit in rheumatoid arthritis. Remember, immune cells are complex. They come from our bone marrow. They are revitalized and aimed in our spleen. The pancreas is involved. It's a very, very complicated process. So we have to use CBD for a longer course of time to understand if we can help with the autoimmune condition. Now, in terms of numbers, we want to ask, what do you guys think is the more common form of arthritis? And I can hear the answers coming in, and you're right, it is osteoarthritis, guys. Remember, wear and tear, almost 90% of all people will feel this at one point in their life. Rheumatoid arthritis has a genetic predisposition, but is an autoimmune condition. So the reciprocal question to that is, osteoarthritis is far more common. Which one is more difficult to study? Which one is more difficult for research? And again, I'm hearing the right answer. That's right, rheumatoid arthritis, guys. It's far less common, therefore it is far more difficult to study. But some of the initial things that we have seen in clinic and some of the results that we have experienced with our patients have been very, very positive. We're very proud of our ability to help with rheumatoid arthritis. So it's an excellent thing to keep in mind. Quickly, just to remind, for osteoarthritis, again, as mentioned, wear and tear, it's degenerative disease. The common presentation will be a bad back or bad knees after a long day. If this condition persists and analgesics and painkillers are not helping, and even resting is not helping, well, then a physician will consult a surgeon for joint replacement. Okay, that is the true treatment for osteoarthritis, a knee replacement or a hip replacement. There is no such thing as a back replacement. But if the joint is able to be replaced, they will consult a surgeon on that, and that is far, far later in life. Sometimes patients have pain in their knee and they talk to their doctor and they say, well, I heard so-and-so had a knee replacement and they're doing better. And the physician will turn to them and say, well, it's far too early for us to consider that option. We have to go through our progressions. Right? And that's the reason why. They don't want to jump into surgery and put everyone under the knife just because it's a wear and tear condition. So you want to save that option until the very, very end if you can. So fast forward into some of the things that we want to discuss today. I want to say very, very clearly that we're very, very proud of this next slide here. And this is Apollo's research study on medical cannabis for the management of chronic pain. Now, I understand today's topic is for arthritis, but again, like I mentioned, a large percentage of our patients are suffering from arthritis and they get put under the umbrella term of chronic pain. So these numbers we're proud of, guys, and the study is large. We're looking at 751 patients, okay? There's a breakdown to male and female, and the average age of the patients was taken into consideration as well, 49 years. So after 1 month of use, we saw a 27% reduction in pain after 1 month. After 12 months of use, we saw a 43% reduction in pain. So remember, guys, these are averages. There were people that were much, much better, and there were people that were not quite as high. But on average, we helped people reduce almost 50% of their pain, okay? Also, the study showed us, and again, we were objectively studying chronic pain, but a lot of the patients said, you know what, I'm also feeling better. I also have a far better mental status. Now, is it psychological relief coming from the approach of addressing their chronic pain, or is medical cannabis playing a role as well? We'd like to say it's both. We'd like to think it's both. Okay, we'll have more research coming and more papers proposed as we continue. And obviously, we've done a presentation on mental health. We understand its importance. We'll continue to monitor. The last point on this slide that I thought was very, very interesting is its opioid reduction properties of medical cannabis, guys. I'm not going to take too much time in discussing the opioid crisis. We understand that this is something that is very real. Physicians are working diligently to try to reduce opioid dosages with their patients, or sometimes not even going to that direction. Now, I don't want to throw shadow at anybody. Opioids are a viable option for many physicians when it comes to a case-per-case basis. But what we found in our clinic is that there's an over a 50% reduction in the dose of opioids used in this study, right? So we're looking at a reduction from 26 milligrams per day on average down to 13. So that's 50% less than what they were using. So again, these are patients that were followed over a course of 12 months for chronic pain and the use of medical cannabis. We're very, very proud of this study, guys. I've put this slide here just so people understand. Although I am discussing the different types of arthritis today, osteo versus rheumatoid, these are some of the other potential benefits that we have found for medical cannabis. Anxiety, insomnia, PTSD, and of course, chronic pain. Neuropathic pain is another one. Neuropathic pain is generally followed by patients who have a long-standing history of diabetes. Okay, very rampant condition that has been very well addressed by modern medicine recently, but neuropathic pain is still very, very rampant and found often. Fibromyalgia is a diagnosis of exclusion that we see in clinic as well. A lot of times, fibro patients don't suffer from just fibro. There's a lot going on with them. And again, osteoarthritis is very commonly seen with fibro patients as well. MS, migraines, and epilepsy. These are things that we deal with on a regular basis, guys, just so you know. That brings me to the end of the presentation that I had for you guys. And now I wanted to focus on a few of the questions I was going to go through. So I'm going to go through them and explain them to the best of my ability. And I want to take just a quick moment to mention to you guys, we very much appreciate the feedback that we are getting on our Facebook page, on our Instagram page, and to our support at email address. A lot of patients have been asking us questions and they're looking forward to these presentations. I want to say thank you. We love getting the questions. I'll address as many of them as I can, and we'll continue to answer them even after these presentations are done on a one-to-one basis. So again, thank you, and keep them coming. The more, the better. So this first question comes to me from a patient, or sorry, I'm not sure if they're a patient of ours, but Mylene is her name. How many milligrams of CBD per dose of arthritis? Guys, this is an important question to address, but what we have to firmly understand before I address this question is that there is no such thing as a one-size-fits-all when it comes to medical cannabis, okay? We initially start off with a very, very low dose, and we graduate up slowly, okay? Sometimes a patient will tell us, well, I got to 0.6, and I found that was beneficial for me, and I didn't go any higher, but around 3 o'clock every day, my pain came back. Well, what we told them is if you're taking a dose at 9 a.m. and you're good until 3 o'clock, let's add a second dose, again, starting at the minimum and increasing slowly 2 hours before that occurs. So let's take the dose at 1 o'clock to address the pain that comes from 3 o'clock onwards. And again, we've had tremendous success doing that in clinic. So having said that and having addressed the fact that there is no such thing as one size fits all, we continue to understand dosing as we go. And as mentioned, for osteoarthritis, a lot of patients will use it when their condition is present. If their condition is present every day, they will use it every day. If their condition is present after a certain event or a certain day of the week, then that's when they will use it. With rheumatoid arthritis, we will find the dose that they are benefiting and we will continue to use it regularly, like mentioned, for about 4 to 6 weeks before we can change anything and say that we need a dose adjustment, right? It's very important. The goal of treating any condition when it comes to chronic pain is to reduce synthetic medication use, guys. So if I can help a rheumatoid arthritis patient not use prednisone or not use methotrexate or not use any other biologic, that is considered a huge victory if we're slowing down disease progression. With osteoarthritis, we're replacing the Tylenol, the Advil, and some of the other more harmful NSAIDs that people are potentially using. That is the true benefit of medical cannabis, that it is far more harmonious in your body, far less side effects, and far more beneficial with the same level of pain relief as to a lot of the traditional medications that have been used for decades. So good question. The next one comes to us from an anonymous individual, and the question reads as follows. I was diagnosed with psoriatic arthritis, but then it was reversed recently and changed to osteoarthritis. Okay, also have fibromyalgia. I also have asthma and a lung granuloma, so I don't want to smoke or vape. Great, we are on the same page. So I'm gonna address this piece by piece here. Remembering first, psoriatic arthritis is an autoimmune condition. They probably thought this patient had psoriatic arthritis, but they couldn't prove it objectively. The labs were all negative. So then they said, okay, this is not psoriatic arthritis. This must just be osteoarthritis with some skin conditions that are following. So osteoarthritis, already discussed, degenerative disease. We can treat it with CBD. Fibromyalgia, diagnosis of exclusion. They couldn't find out where the pain was coming from, so now you've been diagnosed with fibromyalgia. And again, we talk about the chronic pain cycle and how we can help them with sleep, help them with pain. We've taken 2 off of the list. The third one is an asthma and lung granuloma. I don't want to get too detailed, guys, but asthma is a reactive airway disease in which your bronchioles, the pathways of air coming in and out of our lung are quickly constricted due to an allergic reaction. It could be dust, it could be pollen, it could be anything, dander, pets, cats, all of it. I hate to pick on cats, but they're often the ones that get the most complaints because they have a lot of hair and dander. So again, that's asthma. CBD can play a role in an anti-inflammatory, but to the quick rescue of salbutamol, which is the medication for asthma, is still the first line of treatment. We have a lot of asthma patients that come to our clinic, and what they say is after a while using CBD, I need my inhaler far less. So that tells us the anti-inflammatory effects of CBD are helping that patient. The last piece of that question, this is a very loaded question. The last piece is the lung granuloma. A granuloma is a portion of tissue that has been walled off by our immune system. Now, I don't know about this patient's past medical history, but granulomas are often observed in patients who had previously suffered from tuberculosis or any other type of lobar pneumonia can also have granulomas. So CBD does not play a role in that area. That I understand that we are not inhaling any form of medication for this patient. That does not mean the inhaled form of medication doesn't help people. We have a large number of patients that are benefiting tremendously from inhaled forms of cannabis, but in this particular case, we would be able to help the osteoarthritis and the fibromyalgia, and I can apologize to you for the misdiagnosis of psoriatic arthritis, but you should almost be happy about that. Psoriatic arthritis is a very serious diagnosis, and for them to think that but go to osteoarthritis is a small celebration, believe it or not. So thank you for that question. Oh, I'm sorry, this question also had another piece to it. I just scrolled down and saw that. Right now, I am taking yellow gel capsules 3 times a day and red at bedtime. Any advice would be welcome. Well, that's an excellent course. If it is working, we leave it be. If you're not attaining a full benefit, we would want to touch point with you about the titration and the strain. What do I mean by that? Well, maybe this person would benefit from a lower dose more times a day, or maybe this person would benefit from a larger dose less times a day. That's something that your physician would like to discuss with you. And also, I don't know what your dosage is of the red. This is referring to a product that comes from a licensed producer. Red is the THC product. So again, we would have to address your dose and see how you were doing on it subjectively. If you're going to come back and tell me I'm sleeping 8 hours a night, that's a success. If you're telling me I'm taking the red and I'm still only getting a couple hours a night, well, then we need to address that. And that is something your physician would welcome in terms of feedback, and the Apollo educator team would be able to handle quite well. This is a common thing. So thank you for that question. I don't have your name, but thank you, Anonymous. Next question here. I am an 85-year-old and have been suffering from arthritis most of my adult life. How does cannabis actually work to treat arthritis, and what difference can I expect from the traditional medications I have been prescribed by my doctor and have been using for many years? Can I expect any specific side effects? So a couple of questions in a row here. My assumption is if you've been suffering from it your entire adult life, and we've only said arthritis, not to distinguish between osteo and rheumatoid, my assumption is that you are of the more common type of arthritis, which, if we remember, is osteoarthritis, and that is something that is very common. So we are going to step back and understand what cannabis can do for this particular case. For the osteoarthritis, I can help on 2 fronts. A painkiller, and B, an anti-inflammatory. Osteoarthritis of the joint is initially just inflammation on site. If that inflammation goes on continuously and is left untouched or non-addressed, and the patient continues to overuse that joint, well, then guess what? That on-site inflammation will become systemic. Systemic inflammation can trigger aches and pains all over the body. Okay, it's very common. Someone will say after a long hike, I came home and I had a sore back, and the next day I had my knee and my ankle and even my shoulder from high school is hurting again. Well, guess what? Inflammation turns everybody on. So CBD can help as a pain reliever and an anti-inflammatory. Additionally, it's important to understand that some of the traditional pain medications that are being used do come with a longer list of side effects. When it comes to medical cannabis, the main side effect we watch for with CBD is an upset stomach. The main side effect we watch for in THC is overstimulation. If someone does not feel well, they have gone past the point of medical cannabis And that's not something we want, guys. Let's make it very, very clear to everybody who is listening today. Medical cannabis is not designed for recreational use that way. There are patients who will say, you know what, I accidentally took the incorrect oil. I took my nighttime oil in the daytime, and I felt a little bit loopy. And what we have to tell them is, well, you're going to stay put, be in a safe place, stay comfortable. It will pass. There is no other side effect that patients have to watch out for. There is no risk to the cardiovascular system. There is no risk to the neurological system. Nothing is permanent. There has never been a reported case of death due to the use of medical cannabis, which is what gives us so much liberty when it comes to the treatment of patients in so many different factions. We know what we are doing can only help. We are not causing any harm. Now, from time to time, I hear a patient tell me, well, when that happened, I was very uncomfortable and the room was spinning and I had a little more appetite than I'd like and I was excessively laughing. And I understand, right? And I understand, the empathy goes out to those people who experience that, and that's not what we want, but that is something that will not last. And again, like I said, we can go back to addressing the dose and making sure that it is correct for that patient. I hope I answered that question. The specific side effects would depend on the specific medications that are used. Again, none of them are going to be as harmful as some of the traditional medications. They're considered very benign side effects, guys. Next question. I suffer from arthritis in my ankles, but it only flares up when I have engaged in a lot of physical activity. We know that's osteoarthritis. I lost my spot. Where was I? Physical activity. Can I use cannabis topically when I feel my symptoms? That's one question. Will this be an effective treatment plan to manage my flare-ups? Okay, so there's a bit of terminology here we need to address. First of all, a flare-up is caused by the immune system. Immune conditions flare. Okay, so that kind of led me to think maybe this person is talking about rheumatoid arthritis, but it says after engaging in a lot of physical activity. So I think it's just a slight error in the verbiage. So you're feeling the osteoarthritis of your ankles after a lot of use. Remember, osteoarthritis is going to be joints that are worn and torn through time, and they eventually become bone on bone, and that causes a lot of discomfort and a lot of pain. That's not an autoimmune flare. That is cause and effect from the overuse of the ankles. So this would be a very standard case of osteoarthritis that we see in clinic. And although we have many positive experiences with the use of CBD topically, I want to make it known that we prefer patients ingest CBD and use it systemically. The difference being that not all joints can be addressed with topical use. Also, some of the licensed producers, the companies that make medical cannabis for the use for patients, have now started to make topicals, which is fantastic. So I have to get on board. If you are obtaining your topical product from a licensed producer, yes, you can use it. If you are making your own, if you're creating and it's working, good, right? I'm happy to hear it. But unfortunately, with that variability in dose, we don't always recommend it because sometimes a patient will try it and they'll say nothing changed, nothing happened. Well, I don't know what dose you use topically, but if you use it systemically and I have a controlled amount that you were using, I can firmly understand if I need to crank the dose up or turn it down, dependent on your symptoms. So yes, you can. It's not the best route until other producers, all producers, start having topical use. And I think this is just right around the corner, guys. From my understanding, topical CBD and THC infused products are going to be out in a couple of weeks. Again, don't quote me, but fingers crossed, hopefully sooner than later. Also, it's good to remember, and maybe I can touch point on this now, when you do use CBD systemically, it benefits your system from an anti-inflammatory far greater and for far longer. Okay, keep in mind the topical use of any anti-inflammatory will only last as long as that product is on your skin. NSAIDs is another class of medication that is also used topically. People forget that. A lot of times you think NSAIDs, you think of capsules. If anybody remembers, there was a commercial a long time ago that was called Head On, and it is a topical use of an NSAID that you rub on your head and it can help with headaches, they say. Again, that's a different form of NSAID use, and we can put CBD in a very, very similar category. Next question, guys. That was a good one. Thank you. I am a 75-year-old and suffering from osteoporosis and arthritis. but I am very wary about taking medications long term. If I begin using CBD to aid with my arthritis symptoms, can I expect to eventually get off of it and still have my arthritis symptoms relieved? Okay, so again, I'm assuming that this is osteoarthritis because they haven't told me different. That is, again, 90% of what we see, a very high percentage of patients are osteoarthritis. And then osteoporosis. I need to address that. Osteoporosis is a condition in which the bones lose density. Bones become softer. It costs your body a lot of energy to reproduce bones, and they're constantly being used and remodeled, right? So there's one cell that comes up and eats up a lot of our bone, and there's another cell that comes back and lays it all down. So that process costs energy, and as we age, that process slows down. We are left with those cells that are still rampant, that are eating bone up, and not as many cells making new bones. So osteoporosis is softening of the bones that can cause pain. Now, the treatment modality for that is a class of medications that I'm not going to get into called the bisphosphonates. You would take one and they slow down the action of the cell that is eating up bone. But again, medical cannabis doesn't really play a role in osteoclastic activity, which is the cell that makes bone. We know that we can help osteoporosis with pain control. Okay, arthritis as well, pain control. The main question that I'd like to address here is, can I stop using it and be relieved of my arthritis? Unfortunately, the answer to that is no. If I'm going to be direct, the medication will only work as long as you are using it. Okay? Arthritis is a condition that is chronic, it is permanent, and as mentioned before, the true treatment for osteoarthritis is joint replacement. And again, not all joints can be replaced. So generally, when patients stop using medical cannabis, what we hear in clinic is that within 72 hours is when symptoms can return. Now, I agree with you, not using medications long-term is an excellent way of thinking, but to kind of veer in another direction, if the medication you are using is a far less harmful synthetic to your body and is plant-based, and you're benefiting and you're not harming yourself, there is no reason for you to discontinue. You can at any time stop medical cannabis, but it doesn't make sense for a patient who's benefiting this much to stop using it. We see it all the time. Sometimes, again, just to address the use of medical cannabis, sometimes patients will use cannabis for a certain time of year. It's a very interesting phenomenon that we found. A lot of patients will tell me, well, my condition, my pain gets far worse when the weather changes. In the summer, I'm okay, but as soon as fall comes and winter comes and the barometric pressure and the cold temperature, my pain, my aches and my pains get worse. I like to use medical cannabis between set month, and that's when it helps me most. That's phenomenal. That's a patient who's in very, very good control of their condition and can hear their body and understand their body. Other times a patient will say, well, I tried it for a couple of months and whatever was ailing me got better. It was an injury that was due to post-trauma. I fell or I broke my leg or I got into a car accident, whatever it may be. Other patients say this has been something that's been ailing me for 20 years. This has been life-changing. I have no reason to quit. Again, guys, it depends on the individual. It's a case-per-case basis. To answer your question, yes, you can stop, but you probably will not have the benefits that you are attaining when you use medical cannabis. Good question. Next question. Will I be able to cure arthritis with CBD and eventually get off of cannabis entirely while having my arthritis basically relieved? Guys, I just mentioned that. I apologize. Unfortunately, most osteoarthritis is chronic and permanent. So that's the answer to that is no. You can use CBD to address your condition. You can save it for when things get really bad, or you can choose to use it regularly if it's benefiting you to that extent. What is the mechanism that allows CBD to help with my arthritis? Why should I try cannabis to treat my arthritis instead of traditional medications? Another two-parter. So remember, the mechanism is what I showed you on that slide about the pre and the postsynaptic cleft and the communication that is had between your nerves. Cannabis plays a fierce role in that communication system, and it can slow down pain receptors and signaling, right? So you come home after a long day and your knee is just absolutely throbbing. You put it up on a couch, you put a little ice on it, and you take some CBD, and everything tends to feel a little better. You're now able to sleep, and when we sleep is when our body heals. Okay, so that's the whole thinking, the modality of it is to attain benefit from the use of CBD for pain relief. And why you should try it over traditional medications, again, like mentioned, the side effect profile is far lower. The effects on our body are far more benign. What do you recommend for strains? So remember, guys, when it comes to the strains of cannabis, there are lots and lots and lots of different strains. We have a top 4 or 5 strains that we really prefer, and it's purely based on patient feedback. I know that a large percentage of people who use strain X are doing well. I know another large percentage of people who use strain Y are doing well. If strain X and Y don't work, we have strain Z as a last resort. That is the way a physician will progress through strains. Now, to a doctor, they don't really care about the name of the strain. They don't really care about the genetic composition of the strain. They care more about the value of CBD and THC. Sometimes a strain has a little more or a little less. When it comes to medical cannabis, it's not always about more is better. It's about what's correct. And a certain patient's functioning will be improved by strain X, and pain will be addressed better by strain Y. Again, we have to learn that information as we go. So, Michael, excellent question. Thank you for it. It'll be a case-per-case dependent. And again, the strains I recommend will always be CBD heavy and CBD strong before venturing into the world of THC. Can cannabis be helpful for post-osteoarthritis joint replacement surgery? Wow, a very an advanced question. The short answer is yes. The long answer would be definitely, because if we're going to be using less of the synthetic painkillers out there and using more of the benign and plant-based medications like CBD, then we can say we're giving the body less to worry about. What do I mean by that? If I take a whole bunch of NSAIDs to deal with a hip replacement, and those NSAIDs are then harming my liver or my GI tract, well, then guess what? The doctor has one more thing to worry about, one more condition and symptom system to monitor. Then it becomes a little bit more complicated, guys. The complexity of any case of surgery has to do with the procedure and the post-operative medications that the patient uses. So if they give you the procedure and everything goes excellent with the procedure itself, and then the next thing you know, the medications are all causing bad side effects, well then, we're being counterproductive. So the advantage to using CBD for pain relief post-operation is that you won't have to worry about any other side effects, which is an excellent place to be. I think any doctor would be very happy to hear that the patient had less side effects post-op due to the use of CBD as opposed to traditional pain medications. Very, very good question. I like that one a lot. Now, one thing that we have to monitor when it comes to any kind of operation is how long the patient is going to be in hospital. Okay, so if a patient is getting a hip replacement surgery, there's a long follow-up to that. But if a patient is doing something that is, just I'm just going to say a carpal tunnel procedure in which they are just releasing some of the pressure, it's almost a 1 to 2 day event. So do you really need a huge post-op for that procedure? No, but for a hip replacement, you definitely would. And again, it would be dependent on that patient's status and their condition and how they can use medical cannabis. So yes, you can use it. And in fact, that might be an area in which medical cannabis will thrive in the next couple of years once we learn more and more about the plant and the medication itself. All right, guys, that's all I have for questions. And I think that brings us to the conclusion of this presentation. I want to thank everybody for tuning in. And I also want to say thank you to everybody who sent questions to us, reminding everybody that we are able to help our existing patient base and take on new patients coast to coast as we continue to abide by the guidelines set forward by the federal and provincial governing bodies towards COVID-19 and social distancing. So we are available, we are here for you, and hopefully these videos are allowing our patients to connect to us, and hopefully we address some of the concerns that people have. Please continue to send questions into us, and if you have any questions, please feel free to reach us at apollocannabis.ca. I reiterate, apollocannabis.ca is where you can find the best form of communication to our clinics and potential information or questions that you may have. Thank you so much. Have a great day, and looking forward to hearing from you more.